joining us from. Whether you're joining us from any of the 3 counties in Guyana, across the Caribbean, or anywhere in the world, we'd like to welcome you to this brand new show called Innovative Dentistry. I'm your host, Akash Persaud. And on this program, we'll be discussing various aspects of general oral hygiene, dental care, and special issues that may require dental interventions or medical intervention. This program is brought to you by Innovative Dental Care, and we are coming to you live from the studios at TBN in Georgetown. One of the things that we'll be looking at is, well, not one of the things, but many things that we'll be looking at is to start from where really dental care begins, and that's where we'll be starting tonight. But to tell you everything about this new show and what we will be talking about, I have in studio with me here one of the best men I've ever met, and one of the best dental surgeons and prosthodontists that I've met is Dr. Pico. Dr. Pico, welcome to the show.
Thank you so much, sir. A pleasure.
Great. So, Dr. Pico, I have to ask you first. How long have you been a dentist?
Well, I graduated in 2004, so I have been a dentist since 18 years now. About the prosthodontics, I studied that in 2000. I finished those studies in 2010.
2010.
So that is
How long have you been in Guyana?
I reached to Guyana in 2015.
2015.
Yes.
Wow, that's a long time.
That is 7 years now.
Yeah. You're Guyanese. You're Guyanese in every way. If I may share a little story, when I met Dr. Pico in 2015, I met you too, right?
Yes.
Yeah, we met at a party. Back then I used to go for, I used to enjoy a few drinks. Both of us actually. We don't do that much anymore. I remember we met at a party, and about a year after that, he was learning English, and of course, like a proper Guyanese, I was trying to teach him all the bad words first, And I remember we were going to this party, and Dr. Pico was asking me. He said, "When I go to this party, what can I say that will, make me feel like Guyanese?" So I'm telling him, I said, "Okay, when we go there, we're gonna say, I know this guy's gonna have a lot of lick on the table, so I want you to say, whatever the guy name is, and say, Roma kick dag, like we would say." So right through we practicing, and I remember you saying to me, you keep asking me the same thing over and over, and I keep saying, "Well, yeah, that's what they were saying it right." And the moment we got there, he called the guy name. He said "daga kick rum" instead of say "roma kick dag." That was so funny. But you've come a far way, and it's good to see where you're at now. So you have a clinic. You have your own clinic now, and it's called Innovative Dental Care. Want to tell us a little bit of how you came to that?
Yes, recently I opened my own dental office. I chose that name because I want to bring to Guyana all the latest technology in dentistry. So
Okay.
I make all the efforts to do so. And that is the name that I chose for the office, because everything is in the actual situation of the country.
Mm-hmm.
Guyana is reaching into the future, a much better future, a brighter future for everybody, for all the Guyanese. So that is the type of dentistry that has to match into that actual situation of Guyana.
Wow, fantastic. Where is your clinic located?
My clinic is located on the 1762 railway embankment, Commons Lodge, East Coast, Demerara.
Okay. I think so. That is. I think it's a few buildings after UG Road.
Mm-hmm.
If you're going towards Industry Mahika side, it's about 4 or 5 buildings on your right hand side. It's a big gray building, and you'll see the sign there, Innovative Dental. So, Dr. Pico, it's a pleasure to have you here, because and let me tell you what happened. Your teeth in the morning before you go to school. Not much effort was put into informing people or educating people about proper oral hygiene. So, so right off the bat, I want to ask you this question: where does oral hygiene, general oral hygiene, begin? When does it begin? When does it really start?
Well, generally, people have the misconception that the oral hygiene start once you have teeth in your mouth.
Yes.
But it's not like that. The oral hygiene start a little bit after, a little bit before, sorry.
Okay, yeah, yeah.
Once the baby is born, the parents, they have to cater to see and learn what is normal in the baby mouth. Everybody has to go and check our to get to know our body. So the parents have to go and check first. The parents are in contact with the baby, so you don't have to get any certification to see and check what is normal and what is not. So
we have a photograph of a normal baby's mouth. I'm going to put up on the screen. I want you to indicate to us what what is it that we're looking for here.
So you are seeing there on that picture a normal baby mouth. Okay. So what you have to see there is the symmetry. The symmetry of all the structures, the lips, the tongue. There is no any asymmetry. There is no any bumpy area. There is no the mucosa inside. The mucosa and the gum are pink. Okay, so you have to check all the things in the baby mouth. And once you have to be gentle, of course. You don't have to push the newborn to open the mouth. While the baby is yawning or when the baby is crying, and so you just go and check that everything is okay in that little space. And if the parents see anything that is out of the normality, if there is something abnormal, then they have to seek for attention. They have to go. You can go with a pediatrician, for example, or to have a look of the condition, and then you will take it from there, because in the medical field, in the dental field, the prevention is better than the cure. Okay. So once you get anything that is not normal, if you get proper attention since the very beginning, then the results will be much better.
Okay.
But yes.
No, I was just going to say to the folks watching out there, this is very interesting because we always believe that dental care begins when we have our first set of teeth. But here it is, what we were learning about this. So I'm going to encourage you right now, if you're watching this program right now, you know somebody who has an infant, a newborn baby, I suggest that you call him up right now. Tell him to tune in right here on the Guyanese Critic page. We're coming live from the studios of TBN. And we are live on YouTube also, on TBN page, on Facebook. Ask them to join in on this program, because the information you're going to be getting here right now is one that you may not necessarily would have known, and it will be really good for you to be equipped with this knowledge. So, Dr. Pico, so again, was it like 2 days old, 3 days old, 5 days old? When can that inspection be done? When is it safe to do such an inspection?
Well, you don't have to do it right away when the baby is born. You have to maybe wait a few weeks.
A few weeks.
And go and do that little checkup. Sometimes by yourself. Sometimes you will notice, the parents will notice something really, really wrong. Like for example, when you have a cleft palate or cleft lips, which is very noticeable.
Well, I have a picture of that. Actually, this one here.
Okay.
This one is very common. I know about this one for a fact. So explain to us what this is.
Those are stem pairs. Those are epithelial cysts, and the reason of that is because there are some structures that are the origin of the teeth, and those structures have to remain inside of the bone, and sometimes pieces of those structures are remaining under the bone. So these are not harmful lesions. These lesions will disappear with the time. So it's nothing to worry about. But anyway, if the parents don't feel safe, they can go and get a checkup for the baby with the professional attention. But are safe, are not harmful lesions. So it's something that will disappear with the time.
Okay.
As the baby is developing, in few months, the lesions will disappear.
Fantastic. When a baby, when they're in that infancy stage, I know sometimes we take a little rag, and I cannot remember what is it, the little thing that they place on that rag, and they clean the baby's mouth. But I'm thinking whether when a baby has an issue like this here with this with these Epsom pearls that you call them, how do you clean that generally? Is it does wiping that area make it irritate it, or how do you care for a newborn?
Of course, the parent have to be very careful. They have to do it in a gentle way. You cannot be rough doing this kind of cleaning. The proper way is to use a gauze that you can buy in any pharmacy, because a gauze is something that is commonly sterilized. You don't have to wash it. You don't have to do anything to that.
Okay.
Just buy the little package. Open the package, and with saline solution, that also you can buy those solutions at the pharmacy over the counter. Wipe out the gauze in the saline solution, and very gentle, in a gentle way, just put your finger in the mouth and start rubbing the mucosa, the tongue, the gum, to remove, like for example, a little layer of milk that will remain there while the baby is breastfeeding. You cannot leave that there, because the mouth of the little baby is a warm area. It's a dark area in which bacteria can grow there. Like for example, the baby can get, for example, this type of yeast, which is a normal microorganisms in the mouth. If you provide them the proper environment to grow, if you leave that rest of milk in the mouth, then those microorganisms, which are fungus, will grow, causing a throat infection, which is a very common infection in this period of time. Of course, that is not the only cause of this type of fungal infection in the mouth, but you will avoid this type of infection by keeping the mouth clean in an early stage.
Okay, and you're saying that, and how often should a baby's mouth be cleaned?
You have to do it after every breastfeeding, or and we know that sometimes after the baby finishes the breastfeeding, usually is go to sleep. So at least you have to do it one time in a day.
Okay, at least one time a day.
At least one time a day. At the end of the day, so you will go and do that type of cleaning. Also, you can do it 3 times daily. When like more frequently is much better, but you have to be extremely careful. You cannot be rough, okay? Because the mucosa is thin and is very delicate.
Yes, I know. I would understand that, because babies are pretty small, and then the skin is thin and all that. Another thing that I saw here, this diagram here, this picture here, I don't know how common this is, but tell us a little bit about this tongue tie.
Oh yes, this is a pretty common type of lesion. It's a tongue tie, which is something that later on will be avoiding for the baby to speak properly.
Right.
Because once the tongue cannot move properly, then during the period of time in which the baby will learn to speak, that will be something that will not allow the baby to pronounce some type of words. So it's something that you have to remove that tongue tie in order for the baby to develop a proper speech. Okay, so you don't have to do it so early, but you have to do it in the before the baby is going to learn the first learn to speak.
The first words.
Yes.
Because I remember growing up as a child, you'd hear that somebody who has a speech impediment, you'd hear somebody say, "Oh, you got tight tongue," But I never really understood what tight tongue is, and I that actually this is what caused it. And I thought that when somebody has tight tongue, well, that's it for life. You go through life with that speech impediment, and that's how it has to be. Not knowing that that an early intervention can actually change all of that.
Exactly. Yes.
Yeah. And how big a procedure is this to have this done?
It's not a type of big surgery. The scary part is that you have to do this in a baby, which is, the baby, you have to go and do it under general anesthesia or under sedation, because of course you cannot do it in a baby that even when you get to numb the area, the baby will be moving and crying and so on. So you have to do it under general anesthesia or sedation is more safe, and it's not a huge type of intervention. It's just cut the frenulum, which is the structure that is keeping the tongue tight. And like for example, nowadays it's very easy to do it with laser, because the laser is cutting and at the same time is coagulating the area, so there is no bleeding. You don't have to take place sutures and so. So it's pretty more easier and
more effective.
And yes, and the healing process is faster with laser.
So and if you were to recommend a specific age where this sort of procedure is most likely or is best to be carried out, what age would you think is best to do this?
As I say, as soon the baby is going to learn into learning this, how to speak.
Yes.
So you have to do it before, because by doing that before, then the baby will not carry on problem with the speech. Because if you have something that is tight in the tongue, then the baby will not be able to pronounce some kind of words that are need the tongue for the tongue to move freely. Okay, so as soon, some babies are learning to speak fast. Some babies are learning to speak a little bit late. So you have to take care of that type of that situation. Okay, before the baby is learning to speak, then you have to do this type of intervention.
Dr. Pico, this is really refreshing, and I wish I have a son who's 18 now. I never knew these things about early oral hygiene for a baby, and I'm happy that if you guys are, if you're joining in and you're watching us, that you'll be sharing this information with anyone who has newborn babies or are potential mothers or fathers of babies very soon, or if you're planning on having children, then this is the right program for you to be listening to. Another thing that I see you sent me here is, I know this one is very common, because I remember always you hear that babies are having this sort of problem, and I must add that this one here, mouth thrush, there's a lot of unconventional medicine. People say you can use this herb, you can boil this thing in water, and some auntie can say, oh, just carry this thing and boil them in one pot water and give the baby a little bit for drink more, and baby, but mouth thrush, what causes this, and how can we deal with this problem?
Yes, this type of lesion, the mouth thrush, or scientifically named candidiasis, is caused by an yeast, which is a type of fungus that is living in our mouth normally.
Yeah.
But you know that our mouth is full of bacteria that are working in a balance. So this type of disease will start while the baby is going into any antibiotic treatment, because by giving antibiotics to the baby, you will unbalance the whole microorganisms that are living in the mouth. So once they are unbalanced, then the yeast will grow more than the normality, and causing this type of infection. Also happens when the mother is consuming antibiotics during the pregnancy, and then while the baby is born, then the baby will get, since the antibiotics are circulating, and so the baby will get this type of infection. Okay. Also, it's a type of infection that the mother can be infected, and they will be passing each other the infection. So while the this is happening, sometimes even the mother has to go into the treatment because to avoid the reinfection of the baby. So it's as I say, it's a fungus. You have to use some type of specific antibiotics to treat this type of infection. But however, you don't have to do that by yourself. You have to go and get medical attention because maybe the lesions are maybe it's not that type of infection and it's something else. Okay, so you have to get medical attention to get the proper type of treatment.
And it brings me to ask you another question. A common thing, and this is, I know this for a fact. I mean, we're all emotional about our babies and all of that. Oh, the baby's so cute. Maybe just want to hold the baby and kiss up his mouth. And funny enough, you mentioned something that infection can be passed from one person to another. The yeast infection, the yeast that you're talking about lives in our mouths. It obviously it's in adults also, right?
Exactly.
And then people have this thing about them where they like to take the baby and kiss the baby on their lips. Baby looks so cute, and the mommy and daddy kiss up the baby. Grandmother come kiss the baby. Some some of the grandmother even got no teeth in their mouth. They kissing baby to just because both of them got share gum, and they're kissing the baby, and it makes me wonder now whether that is highly responsible for babies having such infection.
Yes, what is happening here that as a baby, the baby is a little person that is growing, so even the immunity is growing. So the baby is not the immune system of the baby is not fully equipped. Help me with the word, please.
Yeah, I know. Yeah. They don't have
yes.
the antibodies in their body. In their body. Yeah.
The immune system is also growing.
Yeah.
So the baby, you have to be extremely careful with that. You cannot expose the baby to certain type of environments in which they can catch infection very easily because the immunity or the immune system is not ready so far. It's growing. Doesn't mean that you have to put the baby inside of a capsule and so on.
Yeah, I understand.
Because if you do that, then the immune system will
never
grow.
Yeah.
The immunity is something that is a learning process.
Yeah.
In interaction with the environment, then the white cells will produce the antibodies and so on. We will get all the set of tools that we need to defend our body. So, but in that case, you have to be careful because that is that type of habit that you mentioned. We need to avoid that because even not only a fungus, you can get a virus also.
Okay.
Like the herpes and so is something that
herpes
is something
wow.
that the baby can also
just by kissing a baby on the lip.
Exactly, and it's pretty looking like this type of lesion. So that is why this is the situation that any of the parents are having right now. You have to go and get medical attention because the treatment for a fungus is not the same treatment for a virus.
Yes.
So it's something that we need to be careful.
So because I was just going to thinking, I was just going to be devil's advocate and ask you the question: since the body at times needs to be exposed to certain viruses, it can develop an immunity. Then, is this such a bad thing for a baby to have a mouth thrush? Because obviously they will develop immunity to it, or they don't need to go through this kind of thing to develop proper immunity. And I don't know. I'm just asking this question because I'm thinking from my perspective, if you need to, some people when they were exposed to certain viruses, like recently we had the coronavirus. Many people who were exposed to coronavirus, they became immune to it because they would have gone through that state of being infected. So I'm asking the question here to understand that I'm not saying that babies should be infected, but I'm saying what does this do for their immunity?
No, the reason why is that you have to be careful. You cannot expose them in so early stage.
Right.
So everything is having their own time. So you cannot just expose the baby in an early stage. And so the baby immunity will be developing little by little. So you have to be careful. You have to keep your baby safe in a safe environment.
Now the reason I ask that question is because somebody might want to ask the question. Well, if it's going to help their them to develop better, so what about it? So I'm asking the question so that we are clear on that. All right. So that's mouth thrush. So going back to the same thing again, as I mentioned to you earlier, though, that there is this general idea that you can just get some herbs, some bushes, and so on, put it in a pot, boil that, and you put it in a little drop or something, you give the baby, and that helps with this mouth thrush. And I know this one much because I always hear that, oh, baby get thrush and that kind of thing, and you got to do this for them, right?
Mm-hmm.
This is what will help. What is your take on using herbs on conventional medicine?
Okay, so about that, I know that Guyana is, or Guyanese are very, how to say,
Yeah, we believe in we little herbs and so on. Yeah,
exactly. Which is not bad. Unconventional medicine is not bad because at the beginning of the humanity we used to use plenty herbs and so on.
Exactly.
Those type of things help.
Yeah.
But in this specific case, I don't really recommend to go into that type of things since you have medical professionals that can help you much better. So since it's a little baby that cannot say, okay, this is not working, or I feel worse, or I feel it's working for me, you much better don't apply those type of things and seek for medical attention, okay, to be on the safe side in this type of cases.
Right.
Okay.
So folks, you're hearing it from Dr. Pico. Try to avoid using the bush medicine and applying herbs that might not necessarily be good for this baby. It's better to seek medical attention. Go to your pediatrician or your family dentist, and they will give you the right advice. The next image we have here, I don't think this is very common, but I know that happens because I've seen people who have this here with babies and so on. Sometimes what happens is that these babies become adults and they are left with that. What is exactly causes a bilateral cleft on the lips, and how can we deal with this?
Well, as you can see here, it's a very noticeable type of lesion. So it's something that, of course, that if you see this, but also will not be so common right now. With once the mothers are going and get an ultrasound, so you can see this type of lesion developing. Okay, so this because of this reason will not be so common right now. You can choose to interrupt the pregnancy, or because sometimes this type of lesions also are coming associated with malformation in the heart. So it's something pretty complex. So, but once the baby born like this way, it's possible to fix this by surgical procedures.
Okay.
Okay. So the baby will it's a type of lesion that will request more than one surgery, because usually you do an intervention on the lips, and if the cleft is also at the palate, you will go and do the palate later on, and then the baby has as a little once the baby reaches to the young to be a young or a teenager, will go into some kind of specialist to help them with the speech, to develop a much better speech, because this type of lesion also will avoid for the young adult to be, or the teenager to speak properly.
Yeah.
Because of course it's something that is on the lip and is sometimes involved in the palate. So basically it's something that nowadays we can fix by doing surgical procedures on it.
Yeah. Well, and the other thing is, I mean, kids growing up with these conditions, it's a sad thing that people, they're being called names and all kind of thing. I've seen this happening. People. And what happened with these kids is that they develop low self-esteem. They don't want to go out in the public. They feel as if they don't belong there and all of that. So early intervention here through surgery can be done, but how early?
Well, there is an specialist on this type of lesion, which is a maxillofacial. He will determine when to do it.
Okay.
But in an early stage is much better, because then the failure to learn how to speak is less, since you are doing the intervention on the lips and later on the palate, if the lesion is reaching into the palate. Okay, so also has to be done in a like a team, in which there is a maxillofacial surgeon, there is a phoniatrics, a person that is specialized into
In reconstruction.
of the no, phoniatrics is the specialty to allow you or help you to learn how to speak
Okay.
properly.
Okay. Oh, phonetics. Yes. Yeah.
Phonetic,
Yeah. Yeah.
So it's basically a team, okay, to give attention to this type of cases. Okay, sometimes the team will need some other specialist. Okay, depending on how complex is the case.
Okay. So it can be. Sometimes it's minor, and sometimes it could be really major.
Yes,
Yeah.
sometimes it's just the lips. Sometimes we'll get to the hard palate. Sometimes it's reaching to the soft palate.
Okay.
So it's something that is really difficult for the baby even to feed properly, to speak once the baby is going into the learning how to speak. Also will come with a lot of malposition of the teeth, because it's affecting, some teeth will be missing, because it's affecting the area in which the teeth have to grow, okay, under the gum. So later on the baby will need an orthodontics, or maybe to replace some missing tooth that will never grow. So it's depending on the complexity of the lesion, will be how long this case will be during treatment, on treatment, and also how many people will be involved in to fix this type of problems, and also when to start, how early has the treatment has to be done.
You've been a dentist in Ghana here for what, 7 years? Plus?
7 years now.
7 years, yeah. In your experience here, can these types of surgeries be done here in Ghana?
Yes. There is a doctor, which is a Cuban doctor. He used to work at Kudran Hospital, I guess. Dr. Aguilera.
Okay.
He was, because this type of cases was a few years ago very common in Guyana. Very common in Guyana because of the fact that people of the same family, they used to marry.
Oh, okay.
So that not mixing the genes and so is going into taking this type of genetic disease to be there. So this doctor, he did
surgeries,
plenty surgeries, and he helped a lot of these type of cases.
Okay. You mentioned that it can also be related to some heart issues.
Depending on the level of the malformation, this type of lesion, when it's too gross, will also be associated to heart malformation. So during the ultrasound, the doctor doing that will check, once you see this type of lesions in the facial area, you have to check also the heart.
Okay.
Because it's coming with some malformations. Some malformations are compatible with the life, and some are incompatible.
Just what appears in front of you to your eyes, but there are other complications that may come with that also.
Exactly, yes.
Wow. So as we're going along this, the idea of people learning how to care for babies, understanding the issues with babies, and getting the right type of treatment at the right time is really necessary. So another common thing that happens here is when the baby starts teeth, when they start getting the first 2 teeth, it's always exciting and everything like that. Everybody's like, you're taking a picture, like tell the baby to smile because you want to see the first 2 teeth. It's such a cute thing, But there are some issues that with teething, that when the baby is teething, They have all these symptoms, and I think we have a graphic here of it. They have these symptoms, and I know in Guyana here that when the baby is teething, there are various things that people will do. There is, I think, there was some kind of gel called Bonjela that they would put on a rag or on the fingers and apply it to the area, because they said it soothes the area where the baby's teething. It's probably less irritable. And there is also, sometimes people put the teething ring, the teething ring the baby bite on. They'll put it in the fridge or in the freezer so it get cold, so the baby can bite on that and think. How do you deal with this, with teething?
In that, this process, the teething process, will start around the 6 months. Once the baby reaches to 6 months, the first set of teeth, milk teeth, will come out, which are usually the 2 lower central incisors.
Okay.
And then, from then, every 6 months, a pair of teeth will come till the whole process is completed with 20 milk teeth. So, but prior to this process, the baby will start being irritable, changing the sleeping habits, will be drooling. The baby will refuse to feed and be, as I say, irritable. So those are signs. Also sometimes you will see some kind of rash around the lips, which are signs that the process will start. And as I said since the beginning, if you as a parent, you check the mouth of your baby in an early stage, you will notice once the baby is going into the process to get the first set of teeth, that the gum area will be slightly inflamed, or you will notice some bumpy areas. Those are signs that the teeth are coming out. So, about how to take care of the babies in this situation, I don't really agree to apply medications and so, because like for example, Bonjela is something that it's a medication. So since this process is a natural process, just allow the process to continue. And like for example, if you put this type of toys in the fridge to get it like a little cold, that can help. It's much better to do that, in my opinion, other than apply a medication. I don't agree to load the little baby with unnecessary medication, for example. But the Bonjela can work if you see that is working for your baby. It is okay. In my humble opinion, I prefer to do it in a more natural way. Like for example, give to the baby a cold toy, because in this period of time the baby will be biting and so.
Yes.
Okay, as a natural part of the process. So just let it continue in
the natural process.
In the natural process.
Yeah.
Yes, exactly.
So again, if you're joining us, we're coming to you live from TBN Studios right here in Georgetown, and the reason why we're talking about infants is because we on this program, what we're going to do, we're going to be talking about from the moment a baby's born until you have the first set of teeth, and we'll keep going until you lose all your teeth. Because they say once a man, twice a child. Perhaps reach the age where you'll become like a baby again and not have any teeth, and you may still require care then.
So we are here to avoid for that to happen.
We are certainly. So that's what we're talking about. We're talking about early oral hygiene for newborns. You did say that after it gradually you will start developing teeth and so on. The funny thing is that what I've seen happening a lot, and I can tell you from a personal experience when I was a kid, the first set of teeth that you get, which is the front teeth, those are the ones that seem to go first. And when I say go first, they don't just fall out. So many times kids you have rotting teeth. The teeth is going, it has gone bad, and I would want to think that is because it was not cared for. It was not cared for in the way it should have been cared for. But again, people say, well, you know what? It's as you said, you said milk teeth.
Milk teeth.
Yeah, I thought milk teeth was just a term that we Guyanese use. I didn't realize. I wouldn't expect to hear you say milk teeth. I thought you'd have said something else. But it's good to hear you say milk teeth.
Mm-hmm.
I thought it was just a general term that as Guyanese would use as to say, oh, it's milk teeth because the baby born and just on milk. That's what I thought.
Exactly. Yes.
But so when they get this first set of teeth, and as progressively as they start going to 3, 4, 5 years old, that rotting of the teeth seems to be a common thing. Have you encountered that here in Guyana?
Yes. It's something that you can see very, very frequently, unfortunately. What I am advising to the parents and what has to be done. You cannot. You have to abandon that type of thoughts that the teeth, because are temporary, doesn't matter to lose those teeth. Those teeth has a big functions that we need to keep. It's not only the function that we know that the teeth are. We use the teeth to chew and cut our food and so. It's not only that. With the teeth, this set of teeth will help this little person to start speaking. There are some words that we need teeth to speak.
To pronounce. Yes.
So if you lost this pair of incisors, top and bottom, then you will not have a proper speech. Okay, so it's very important to keep those teeth, not only because of the chewing or the cutting function of the teeth. Also, these teeth are helping to grow the face of this little person.
Okay.
So the process to get a first set of teeth and later on exchange those teeth for a permanent teeth, that process is coming with the growing of the bone in which these teeth are. So that is why our face is changing during this period of time. So if you allowed, by not taking care, these teeth for the baby to lose these teeth in an early stage, then you are interrupting that process. Also, the milk teeth are keeping the guidance for the permanent teeth that are growing underneath.
Okay.
So if you are removing those teeth in an early stage, then you will go into a next problem that will end up in this young person to need to wear braces later on to correct the teeth. Some teeth will not, the permanent sometimes will come out in not a proper position, or will come out or will not come out, and we will need to pull those teeth in a
different direction.
In a process by using braces, by doing some kind of little surgeries. That all the things are unnecessary if you take care these milk teeth in the very beginning. So that is why, as I say, it is important for the parents to get to know how is the mouth inside while the baby is growing, okay? And once the parents realize that if the first set of teeth are coming out, then you have to start teaching the baby to how to brush. At the beginning, with 6 months, the little person will not be able to brush,
yes.
But you have to how to say, I don't want to say push them to learn, but
okay.
you have
guide
to
them along.
Guide them, exactly.
Yeah.
You have to guide them into learn this habit. The brushing our teeth is a habit.
Yes.
It's a good habit. So we as a human being, we will develop good habits and bad habits. So because a habit is something, it's a neuromuscular pattern that we learn. So we need to teach them to this little person how to brush properly. Will be hard at the beginning, will be a little battle, they will be fighting and so, but you have to keep going and going and going till the baby learn and learn how to brush properly. Okay, so you have to go and check for a soft toothbrush. Like for example, the brand Colgate, they have a huge variety of toothbrushes that you can choose depending on the size of the mouth, depending how soft or hard you want the bruster. And also the toothpaste.
Yes,
You
I
will
was
not
about to
use.
ask.
You will not never use an adult toothpaste in a little child, because the ingredients in an adult toothpaste are different than in a little child. So than the one that you have to use in this period of time, because sometimes by brushing the, the, the milk
Yes.
teeth with the toothpaste, the baby will swallow the toothpaste. So there are some components, some chemicals in the adult toothpaste that
It's harmful.
will be harmful for the baby.
Yeah.
So you have to check also that type of toothpaste. As I said, Colgate brand, they have everything that you need.
They have, and it's available here in Guyana.
Yes, exactly.
Okay.
You can go and check it.
Let me tell you a little story. I remember when I was maybe 3, 4, maybe 5 years or so, right? So I grew up on the island called Wakenham. Ever been to Wakenham? Maybe you haven't been to Wakenham. It's a little island. It's not a little island. It's an island in the Essequibo River. That's where I grew up. Well, as I said, I had the little, the two rotten, as I get two rotten teeth, right? Both front teeth were rotting, and they were, had to be taken out. So my grandmother sent me with I can't remember who's the guy that took me to the dentist, and when we go there, there's this, well, the cottage hospital in Wakenham never had a dentist. So what would happen is that whenever one visits, there's a long line of people because everybody's trying to go there. I had to stand in line. We get in there, man, and I see this. So this was in the late 70s, I believe, right? This guy has this huge syringe. It's a metal syringe, like, or this big needles. I'm thinking, what's this now? So I go up there, and he comes with his needle to me. Back, we would say you got to put the cocaine. What's the right word for it?
Lidocaine.
Lidocaine. Everybody say cocaine, right? You gotta get the cocaine. So this guy comes up to me, and man, I was gonna go scream, and he said, "Stop it, or else I'll put you in my pocket." Man, I look at his pocket, he had the shirt jack on, and I'm thinking to myself, what would happen to me if I go in this map? You know what I mean? I did not even cry. So he applied that, and then they took the thing out, and obviously, it grew back and so on. But nobody should have to. No kid should have to go through that trauma. Of going to the dentist and having to do an extraction and so on.
Sorry to interrupt you there. This is the right moment to say that once the baby get the first set of teeth, this is the point in which you can introduce the baby into the dental office, because you cannot wait for the baby to get cavities to go into to meet the dentist. Because that is why some people develop this type of fear of dentists.
Yes.
So you can bring the baby just for a checkup, or just for a little prophylaxis, so the baby will be learning that to see the dentist as a friendly space. So because if you wait to, for example, introduce the baby to the dentist by doing an extraction, that will be a very traumatic experience.
Wow. This conversation is going so well, and we haven't even gone past, toddler stages yet. And I was hoping to have some, take some calls tonight from people who are watching. But if there are people who want to talk to you about these what you've just said here, how can they get in contact with you? You said your clinic is located on the railway embankment. It's a few buildings from UG Road. If you're going towards Industry Mahika, if you're going north, right? Yeah. So how do they get in contact with you?
Well,
can they call you?
They can make a call. We have a WhatsApp number to book appointment. The number is 677-3853.
677-3853, and the office number?
And we have also an office number is 504-7196.
504-7196.
And a Facebook profile that they can message there.
What's the Facebook? What's the name of the Facebook page?
Innovative Dental Care Guyana.
Innovative Dental Care Guyana. Okay, great. So as I didn't realize it. Time is running up on us, but so we're dealing with early childhood and care for this first set of teeth and so on. how often should that child be brushing?
So now that that's what to say, the child get teeth, then you have to teach them to brush at least 4 times daily.
4 times.
4 times. Yes, this before at morning time, after lunch, after the evening meal, and before go to bed.
Hold on. So how much time adults should be brushing the teeth?
4 times.
4 times, not 2 times.
Not 2 times. That is not the correct way. You have if you are working in an office, if you are working in a factory, if you are working in a field, whatever you have to carry on with you, your dental brush and your toothpaste. And if you are not able to do so, at least have a little mouthwash bottle to wash your mouth after every meal, because the cause of the dental caries, which is one of the most common diseases around the world, is the remaining of food in our mouth that we are feeding bacteria to produce some kind of acid that will damage the enamel, and then that is how the cavities start. So if you don't remove that food, that remaining food, you will go into this type of problems, which are cavities. You will get also gingivitis, which is the inflammation of the gum. So a good oral hygiene will avoid all that type of thing. But the proper how frequently you have to brush your teeth is 4 times.
4
daily.
times. Wow.
And of course, sorry about that. The night time, the one that you have to do before go to sleep, that is very important, because as I said at the beginning, our mouth is cold, is warm, is dark, and is a good
breeding ground
environment.
Yes.
For the bacteria to grow. So if you are living into that mouth rest of food, that's it. You are feeding the bacteria that later on will cause troubles.
That's like you have pets in your mouth. You feed them.
Plenty.
So going back to the children though, we must insist that they clean, that they brush their teeth 4 times a day.
Exactly.
And dental visits, when should that start?
Well, the dental visit, when to start? As I say, once you have teeth in the mouth, or if you notice that something is not right, you will need to get dental attention. And how frequently you will do it? If your mouth is, if you have a good oral hygiene and so, you will do it every 6 months.
Okay.
If it's not, then you will do it every 3 months to make sure that you are keeping a good oral hygiene.
Wow. This is some really good information. I did not realize that there was so much to do with oral hygiene, especially from newborn to toddler stage. We are rapidly running out of time. We're just about 5 minutes more here. We're going to pick up this topic again next week, because we're going to be on every Wednesday from 6:30, and we're going to be discussing various aspects of oral hygiene, dental care, and medical interventions should that be necessary. We're going to deal with things like cleaning. There are different types of cleaning. We're going to be dealing with braces, or what do you call that?
Orthodontics.
Orthodontics, that's right. And we're going to be looking at various aspects of general oral hygiene. Now, what I'll be doing, I'll be asking questions to Dr. Pico, just like the man on the street would want to ask a question, because it's for our knowledge and information, for us to take care of our teeth, so that we don't end up at a very early age with dentures.
Exactly.
So as you said, brushing 4 times a day, it's recommended. Flossing.
Exactly.
And frequent visits.
Frequent checkups, yes.
To the dentist. What happens when somebody, there are some people who brush once a day, twice a day, and some people who don't brush at all. now I know that the implications are that, but could that lead, because somebody has, I remember reading this somewhere that, and this is the last topic we're going to touch on because it's very important, that bad teeth can lead to death.
Yes, that can happen. Yes.
How
Yes.
so? How?
Because as I mentioned multiple times, we have bacteria living in our mouth,
Mm-hmm.
and we have good and bad bacteria. So all these bacteria are controlling each other
Mm-hmm.
by keeping a balance. And if you get a cavity, a really serious cavity,
Mm-hmm.
some type of bacteria will grow more there
Mm-hmm.
than others, and there are some kind of streptococcus and so that can go into the blood and cause an endocarditis, for example.
Mm-hmm.
That is one scenario that can happen. So you have some kind of malformation in your heart. The bacteria will grow inside there, causing this endocarditis, which is a pretty serious disease, and you can end up dying because of that. But also you can lose the vision, for example, if some bacteria are reaching into your eye through a cavity that was not treated in a proper way or is there for a long time. So it is very important to keep our oral hygiene.
Wow. So I hope you heard that, folks, that having bad teeth can actually lead to death. Our time here is up for today, and we would like to thank you for joining us. And next week again at 6:30, we're going to be picking up these same topics again. Dr. Pico mentioned his numbers that you can call him on. At the end of this program, the numbers will be up. You can make note of it, and you can call him or you can visit him at his clinic. As a matter of fact, I think you can, not just him, but the nearest health clinic, dental clinic in your area you can visit is best for you, because he's located here on the East Coast, but you don't have to wait until you get here, because oral hygiene is necessary. And if you have some issues, as he said, a cavity can actually lead to death. So have it checked out. Go to your nearest health facility and meet with somebody who's qualified to deal with it, and to get an intervention done early, yes, because it's pretty serious as we get to understand. Dr. Pico, any final words from you?
No, basically, you say everything there. Prevention is key to get a better life. So it's much better prevent to cure. So an early visit to the dentist can help you to prevent a lot of problems later on.
Wow. All right. Well, folks, again, good evening to you wherever you're joining us from. We're going to do this again next week, and thank you so much for joining us. Be safe out there, drive safe, and just look out for those who are not looking out for you. Bye.